There's a lot of talk going on about health care in this Congress, a lot of talk about the bills that we will see, we haven't seen, and the bills that we may not see. So as we talk about health care, and it was, of course, all of the discussion during the presidential campaign last year, I would just point out that there are good ideas that are coming from both sides of this House of Representatives. Certainly, Democrats are not the only ones with ideas on health care. There are Republican ideas. There are Republican ideas that really should shape the debate of health care reform or the natural evolution of health care that we see going on in our country at the present time. Really, when you look at this, the vast American medical machine, the widget that it produces, what we do on a daily basis in doctors' offices and hospitals across the country, it's that fundamental interaction that takes place between the doctor and the patient in the treatment room. That's the fundamental unit of production of American medicine. And when we look at it in that context, whether it be the treatment room, the emergency room, the operating room, that fundamental unit of interaction, are the things that we are doing here bringing value to that interaction, or are they detracting value? Are they subtracting value from that interaction? And to the extent that whether it's a Republican or Democratic idea, if it brings value to that interaction, that's something that I'm going to have to look at quite critically and quite favorably. If it's something that subtracts value from that interaction, that's something that's going to be very difficult for me to be for. So I try to always look at it through that lens of ultimately it's about doctors taking care of patients. It's about hospitals helping people get well. And to the extent that we can encourage and enhance that process, where there are places where we can help, certainly we should. If there are places where we don't belong, that is between the doctor and the patient, maybe we ought not to do that. It's not about, and let me emphasize, it's not about the next election. It's not about who wins or loses seats in the great economy that goes on here in the House of Representatives or over in the other body on the other side of the Capitol. It's not about the next election. It's about the next. That's why it's so important for us to get it right. That's why the American people get so frustrated with us as a group here when they see us fight about things and never work together. It's difficult, I know. That's why we were sent here. That's why we were elected, to do that hard work and to work with each other where we can, to oppose each other where we must, but to always have focused not November of 2010, but what's life going to be like when our children are the age we are now, when our children's children are the age we are now. What is it going to look like to them? What is health care going to look like in this country? Are they going to continue to be blessed with the advances, the stunning rate of advances that we've seen since the Second World War in the practice of medicine? And it has been stunning. The last 50 to 60 years has untold events. Think of the physician in practice right at the dawn of the antibiotic age, when a patient comes into the hospital, significant infection, and there's just not much they can do but keep them comfortable, perhaps drain an abscess if one is available, but the medications that they had were at best, you hope they didn't do any harm to the patient. Now we have a vast array, a huge armamentarium of medicines to fight infections, bacterial infections to be sure, but also fungal infections and some viral infections. It is an incredible armamentarium that today's physician has. And when you think of the young physician sitting in a medical school or attending the patient in a clinic at a residency program today, think of the things that they're going to have, the tools they're going to have at their disposal. If only we don't screw it up for them today. So we always have to keep foremost in our minds and our imagination what that world is going to look like for the patients of tomorrow, for the young physicians and nurses and folks that work in a hospital to come after us. We have to keep them foremost in our minds. And how great it would be if we didn't even need a healthcare system, if we had a way to keep people healthy throughout their lives. We're not there yet. But we always need to stay focused on that goal, because after all, I'd much rather have my health than my health care. If I have my health, I don't need to worry about my health care. But we know it doesn't always work out. We know people do have problems. We know that illnesses do strike. We know that problems and complications do occur. So to the extent that we can make, when health care is necessary, to the extent we can make it more affordable and more accessible, sure, we need to do the things we can to make that happen. I did not leave a viable and active 25-year practice in medicine to come here and sit on the sidelines. I came here to be part of the debate as the debate was going on, and I tend to be fully engaged. I hope that both sides will stay lively and will stay engaged on this debate. I hope we can have this debate in the light of day and not in the dark of night. I hope we can have input from both sides when this bill ultimately comes forward from this and leaves the floor of this House and goes over to the Senate. Certainly, I know the American people are depending upon Republicans and Democrats to work together, and it is my hope, my fervent hope, my prayer that that is indeed what happens. Mr.